Have you lost a significant amount of weight but don't like the way your face has appeared in doing so? Today, I'm going to talk to you about an option that can help improve the appearance of one's face and neck area after significant weight loss. I'm seeing more and more patients whom are losing weight these days, or what they don't like is really having lost the weight, they start to have a deflated look in their face and along their jawline. What can a facelift correct after weight loss? Oftentimes, patients are on their weight loss journey and they're wanting my opinion to help correct this. And I think one of the more important things to first address is, have you reached or attained your weight loss goal? And when I tell most patients that they're planning on losing 20 or more pounds, to hold off on doing surgery at that point. I recommend patients kind of be at their goal weight that they think they're going to be able to maintain for, the rest of their time. At that point, to think about doing something surgically to improve the appearance of the face. One of the things that I often see is development of laxity along not only the jawline, but in the jowl area. And depending upon your age, there can be significant laxity that contributes to this. It's in those situations that you may be a good candidate for consideration of a facelift. But for the most part, what you'd be looking to do is get correction along the tissues that are above your jaw as well as below your jaw. What it's meant to do is make things look more refreshed. Now, depending upon the facelift that you decide upon, will determine the degree of correction, because there's different facelift techniques out there that are meant to address different features that are bothering you. That's where you need to, see a surgeon board certified in facial plastic surgery. He can examine you and give you some recommendations. The other part that can also be addressed same time is if you develop significant laxity in the neck area, and that's where adding a neck lift to your proposal and procedure to help enhance things. So how does a weight loss affect facial appearance? During the duration of one's life, if you've had significant weight gain or been at a certain weight for an extended period of time, the face has got pockets of adipose or fat that are meant to, give the face volume. And as you lose weight, you're going to lose that fat. If you've had this feature for, say, 40, 50, even 60 plus years, and you start to lose that weight, you're going to have, essentially you're going to lose some volume in here. With that volume loss, the skin that was occupying that volume is going to start to sag. Inherent with this is also age-related changes where you're going to have laxity. And just as skin becomes lax, muscle tissue can become lax, and so it starts to descend. And that's why when people start to lose weight, they can tend to look a bit deflated and they look a bit more aged. It just has to do with just the laxity and the loss of volume that occurs with weight loss. So what procedures can be combined with a facelift after weight loss? So the procedures that can be combined with a facelift after weight loss is you can address things such as the brow if there's been descent. And a lot of times you're not going to have brow descent associated with weight loss. It's more of just age-related changes. But if you're going to be addressing the facial tissues and you feel your brows descended, that could certainly be addressed. You can address the upper eyes and the lower eyes, which are called upper lid or lower lid blepharoplasty. And then you can also address the neck area. Now, another thing that I try to focus on for patients is addressing any skeletal deficiencies, i.e. the chin area. Many times patients overlook the chin, and the chin is very powerful in helping to project a youthful jawline, as well as improving the neckline in this area here. In addition, you may want to think about adding some volume to the midfacial area once you've recovered from your facelift technique, or doing it at the same time. That really just depends upon what your surgeon is seeing and where the weight loss has occurred.